Great. So let's talk about what type of symptoms might we want to use brain spotting for? What are we seeing? And the age ranges, I think, is huge too, to know that we have used this with as young as infants on up to our elders, right? So for infants and toddlers, I have used it on them. Elizabeth has used it on toddlers. We've used it in play therapy and art therapy, sand tray therapy, right? And then we do the traditional where we're sitting by each other brain spotting techniques. So there's a variety of ways to do this. Let's talk about some of the symptoms. What are some of the biggest symptoms that you notice this helps with?
Yeah, so currently in my practice, I see just a lot of trauma work. So we have people coming in who have a lot of intrusive thoughts or memories of some negative things that have happened to them. So I do it a lot with that, a lot with fear and anxiety, just general overwhelm. It can also be really helpful for feelings of depression, hopelessness.
Getting stuck on feelings, it's to me as a brain spotting therapist, I'm like, it's just so fabulous that it's if there's anything that you're, like you said, overwhelmed, being stuck, fears and phobias, we've just helped so many people with brain spotting that it's always worth a try. Yeah.
And so like with our kiddos, generally don't use the pointer a whole lot. A lot of that is very clinician led, kind of responding to their physical cues. We might not even invite them to sit with it for very long, just kind of notice it or even just mark it. So if I'm in the playroom doing play therapy with a kid and I notice that their face scrunches up while they're looking a certain direction, I might just take a sticky note and put it in that spot.
Yeah.
Just to kind of. And basically what that is it's I'm responding to their nervous system, and even having that response and that attachment and that attunement is therapeutically helpful, even if I don't know what I'm responding to.
Yes, and that's what I love about brain spotting is that when we get patients that, like especially teens and kids, is they can't talk about it. But how many adults do we know can't label and identify their feelings? There's just so much there they just don't want to pull out, right? And it's like, well, you don't have to talk about it. Let's just work on it. Or they think, well, I think some stuff has happened to me that is making me this way, right? And it's really fun to work on that too. So that's kind of the key thing, is that even with our adults, we don't always have to know why we have a fear or phobia, right? Or whatever it might be. We don't need to know why all the time. We can actually help the patient with just doing brain spotting techniques. All right. Thanks for visiting us today. Elizabeth, anything else you want to add about brain spotting?
No, but please feel free to reach out with any questions or comments. We're happy to continue this conversation.
Awesome. Thank you. Have a great day.